This is lucky number 7 of our clinical corner. So thank you guys so much for joining me until now, and I hope you enjoyed today's episode too. Today we're talking about manual prompts. So for this episode, when I say manual prompts, what I want to discuss is hand-over-hand prompting, really starting at that full physical prompt. So I know that there's a bunch of different manual prompts that you could use, but today we're really talking about like starting at that full physical hand-over-hand prompt. And I was thinking about the ways in which we recommend use hand-over-hand prompting and the ways in which we actually do use hand-over-hand prompting. So what are the recommendations within the field? I would say the recommendations are consistently prompt from behind the learner when using hand-over-hand prompting, right? I have always been trained in that way, especially when teaching skills that they would eventually do on their own, such as self-help, handwriting, and so on. Now, I didn't personally find any research that validated that statement. However, think about the tasks that we're teaching and our overall goal. Our overall goal for any task we teach is for our client to reach independence, or at least fading from that full physical prompt. We're physically prompting, but also we're making ourselves visually in their frame of view. They may or may not be looking at our faces or hidden cues that we might give, even by accident. Sometimes our faces kind of give away what we're thinking or what we feel the next step is. But if we prompt the skill from behind, we're keeping ourselves out of the visual field and we're keeping our face hidden. The only prompt that remains there is our physical touch. Unless, of course, other prompts are embedded like visuals, but that's a separate story. Now, there are some skills in which it would actually make sense to do hand-over-hand prompting in front of the learner. And the best example I can think of this is for teaching one-step gross motor imitations, such as clap hands, touch head. It would be very difficult to provide a model and then run behind the learner to provide a prompt. It actually most likely would not be a very effective prompt. Another option for this might be having a second person behind the learner if one was available. So that's a way that you could provide the prompt for that skill from behind the learner. This brings me to something equally as important for manual prompting, which is prompt fading. This is important about all prompts, but we're talking about hand-over-hand, full physical prompting here. It's important because we don't want this to be our client. So what's the best way to fade hand-over-hand or manual prompts? There are many different prompt fading methods, but I found this great article by Libby, Weiss, Bancroft, and Ahern from 2008, where they compared most to least and least to most prompting on teaching solitary play skills. Here are the specific fading procedures they used: least to most prompting, most to least prompting, and then in an additional study within this research, most to least with a 2-second delay. Here I put the visual aid from their research where you could see the least to most least, and the most to least 2-second delay. So this is what their specific steps were. And then you could see least to most, they started with independent, light touch shadow, manual guidance at upper arm, at forearm, and then hand over hand. And then most to least was the opposite. Most to least with the 2-second delay. So hand over hand, and then a 2-second delay for all of the other levels of prompting that they were given. They completed 2 studies, like I said, in the same research article. First, they compared the most to least and least to most prompting procedures. Then in a second study, they compared least to most prompting and most to least with and without a delay, 2-second time delay. Here's what they found across both studies, and this is directly from their research, so I'm about to quote them. Okay, so most to least with the time delay is likely the best default response prompting technique when a child's learning history is unknown. So if you don't know the child, they just came to you, you're not sure of their learning history yet, most to least prompting with a 2-second delay. That way you're not allowing them to make a lot of errors, but you're not prompting them before they have a chance to do it independently. Then they say most to least or most to least with a delay is preferable if errors have been found to impede a child's learning or to increase problem behavior. However, most to least without a time delay may produce slower acquisition, even though it minimizes errors. So I feel like that's something that we all knew. Most to least might take longer because you are stopping them from doing it independently because you're going in immediately with a prompt. However, it will reduce errors. So they're saying if you know the child's learning history, you know that frequent errors have found to impede their progress, or frequent errors increase problem behavior, you should use the most to least prompt or most to least with a time delay. Then they say least to most prompting may be preferable for students who have already shown rapid acquisition with this prompting technique. So if in the child's learning history, least to most prompting has been shown to be effective, you should continue to use least to most prompting. And the final thing that they recommend from their research is that progress should be monitored frequently to ensure that errors do not stall learning. So, of course, there are lots of other research to discuss prompt fading. I thought this one was a good summary overall, and it talked about how, in that last bullet point, that progress should be monitored frequently to ensure that errors do not stall learning. Even if research shows that one or the other type of prompt fading procedure is best for a specific learner, keep in mind you need to monitor progress. Since prompt fading techniques may be different across programs you're teaching and across learners, so even if one learner is typically successful with that least to most prompting, you need to monitor their progress, do some error analysis if they're not making progress on it, and think about your fading technique and see if you need to provide something else. All right, so thank you guys for watching this month's Clinical Corner. Next month, we'll be talking about one of my favorite subjects to talk about, so don't fall asleep on me and miss it. And that's a little hint for what it's about next month. Thank you guys so much.